Every single day, thousands of people over the age of 60 wake up feeling completely fine. Yet by lunchtime, they find themselves in the emergency room. Why? Not because they were sick the night before, but because of a simple, everyday habit they did in their bathroom that very morning. A habit you have probably done 100 times this month without a second thought. Medical research, including data from the European Heart Journal, links this one common bathroom habit to nearly 40% of morning heart events in older adults. Yet doctors rarely discuss it because it seems too embarrassing or ordinary. I am Dr. Michael Hart, a cardiologist with over 20 years of experience. In this video, I will reveal exactly what this dangerous bathroom habit is, why it becomes a massive risk after age 60, the subtle warning signs your body is giving you, and the simple adjustments you can make to protect your heart starting tomorrow morning. To understand the danger, we first have to talk about timing. The period between 6 a.m. and noon is what cardiologists call the morning danger window. When you wake up, your body goes through intense physical changes. Your blood pressure does not just rise gently, it jumps. For many people over 60, it can spike 20 to 30 points in the first few minutes of waking up. Your heart rate accelerates, and your blood is thicker because you have been sleeping for hours without drinking water. Plus, your stress hormones, like adrenaline and cortisol, surge to help you transition to being awake. This morning surge is completely normal biology. The problem is not the surge itself. The problem is what you do while your body is in this highly sensitive state. Think about your typical morning routine. The alarm goes off, you get out of bed, and you head straight to the bathroom. You sit down, and if things are not moving easily, you push and strain. You might even hold your breath without realizing it. When you push hard and hold your breath, you are performing something called the Valsalva maneuver. This action drastically increases the pressure inside your chest, which temporarily blocks blood from flowing back into your heart. Then, when you finally exhale and release that pressure, a massive rush of blood floods back, causing your blood pressure to skyrocket even higher than its already elevated morning state. If you are young with flexible blood vessels, your body can usually handle this. But after 60, your arteries are stiffer, and you might have hidden plaque buildup. Your body simply cannot adjust to these violent pressure swings fast enough. When you strain on the toilet during that vulnerable morning window, you are stacking an artificial pressure spike right on top of your natural morning spike. A decade-long study from Japan, tracking over 40,000 older adults, found that those who regularly strain during morning bathroom trips face significantly higher rates of heart attacks, strokes, and dangerous heart rhythm problems. This is not a rare issue. Constipation affects nearly half of all adults over the age of 60. That is millions of people straining every single morning during the most vulnerable time of their day, completely unaware of the risk. Your body usually tries to warn you when this is happening, but most people ignore the signals. Here are 5 warning signs you must never brush off as simply getting older. First, feeling dizzy or lightheaded immediately after using the bathroom. This means your blood pressure is swinging wildly, and your brain is struggling to get steady blood flow. Second, a racing heart or skipping beats during or after a bowel movement. This is your heart rhythm becoming destabilized by the sudden pressure changes. Third, any chest pressure, tightness, or discomfort. Even if it is mild, even if you think it is just indigestion, take it seriously. Fourth, breaking out in a cold sweat or feeling suddenly nauseated while sitting in the bathroom. This is a classic distress signal from your cardiovascular system. Fifth, feeling completely exhausted after a bowel movement. If using the bathroom leaves you needing to sit down and recover, your body is working far too hard and putting your heart under immense stress. So, what can you do to protect yourself? You cannot simply avoid using the bathroom, but you can change how and when you go. Here are the life-saving adjustments you need to make. Rule number 1. Never strain. If you sit down and nothing happens easily within a minute or two, do not force it. Stand up, walk away, and try again later. Forcing the issue is simply too risky for your heart. Rule number 2. Keep breathing. When you do use the bathroom, breathe normally the entire time. The moment you catch yourself holding your breath, you are straining. Let the breath flow. Rule number 3. Delay your bathroom trip, if possible. The highest risk occurs in the first 30 minutes after waking up. If you can drink some water and move around gently for 30 to 60 minutes before going, your blood pressure will stabilize, your blood will thin out, and your heart will be much safer. Of course, the best way to avoid straining is to prevent constipation altogether. Water is your best defense. Drink a full glass of water the moment you wake up, before you even get out of bed. This immediately rehydrates your thick morning blood and helps soften everything naturally. You also need 25 to 30 grams of fiber daily from fruits, vegetables, and beans. A 20 to 30-minute daily walk will also keep your digestive system moving smoothly. Another highly effective trick is to change your posture. Placing a small footstool under your feet while sitting on the toilet raises your knees above your hips. This naturally changes the angle of your digestive tract and makes bowel movements significantly easier, completely removing the need to push. You must also look at your medicine cabinet. Many common drugs, including blood pressure pills, pain relievers, iron supplements, and antihistamines, cause or worsen constipation. If your bathroom troubles started after a new prescription, talk to your doctor about alternatives or dosage adjustments. Additionally, ask your doctor if taking your blood pressure medication at night might provide better protection during those vulnerable morning hours. How you physically get out of bed matters too. When your alarm goes off, do not jump up suddenly. Sit on the edge of the bed for 2 to 3 minutes. This gives your blood pressure time to adjust and drastically reduces stress on your heart. Once you stand, hold on to something sturdy and move slowly. Keep your bathroom warm. A freezing cold bathroom makes your blood vessels constrict, which drives your blood pressure up even further. And if you live alone, never lock your bathroom door. If you ever need emergency help, you want paramedics to be able to reach you instantly. If you ever feel chest pain, severe dizziness, a racing heart, or cold sweats while in the bathroom, do not wait to see if it passes. Get out of the bathroom, sit or lie down in a safe place, and call 911 immediately. Never let embarrassment stop you from getting help. Every cardiologist has seen patients who waited too long because they felt awkward about the circumstances. These changes are incredibly simple. Drink water early. Never hold your breath. Use a footstool. And take your mornings slowly. It is about respecting your body's aging process and protecting your heart during its most vulnerable time of day. Please, do not ignore these warnings. If you found this information valuable, share this video with a friend or family member over the age of 60. You could genuinely save a life today. Thank you for watching. Take care of your heart, and I will see you in the next one.